there's a crew in town. The head hillbillies are making their rounds. Small town whispers loud and clear. The sheriff shot the judge in his chambers chair.
Sheriff got a secret he won't keep. Judge shot dead in his disbelief. A lot of people have some stories to tell. Dark pass away, get the sound of a shotgun shell.
All the secrets spill on down. Voices loud in this old town. From the courthouse to the ground, rumors fly and they can't be bound.
Neighbors hide behind their blinds, whisper tales of troubled minds. Skeletons covering the mountainside, a treacherous reality in the pines.
Winter reveals the hidden lies. Moonlight couldn't mask their cries. Shadows caught in sunlit skies. There's no cover, no disguise. All the secrets spill on down. Voices loud in this old town. From the courthouse to the ground, rumors fly and they can't be bound.
Winter reveals the hidden lies. Moonlight could mask their cries. Shadows caught in sunlit skies. There's no cover, no disguise.
All the secrets spill on down. Voices loud in this old town. From the courthouse to the ground, rumors fly and they can't be bound.
You are unmuted.
All right, could I see counsel at sidebar, please? All right, so let's bring the jurors in, please.
Leave it for now. Tonight's court, jurors entering. Please be seated.
Good morning, jurors. So an issue has come to my attention that is going to make it necessary that I talk to each one of you individually over at sidebar with counsel. So that process will take a little while. So I'm going to, don't speculate as to what I'm going to talk to you about. Please, when you go back to the deliberation room, talk about anything but this case, and I'll see each of you individually in the process. The cameras will be shut off, and I'm going to talk to the lawyers about whether we clear no filming. All right, send you back, and we're going to send you back. Thank you very much.
Court is rise, please.
All right, now I'll see counsel.
Muted.
Please be seated.
All right, so jurors, I still have a couple of questions for you. Were you able to follow the instructions and refrain from doing any independent research or investigation into this case? And we've discussed the other two questions, but I do need to stress for you that it's very, very important that no one discuss this case. Don't let anyone talk to you about the case, no comments about the case. You've seen how hard the lawyers have worked to pull this case together for you, and everybody's given it so much time. So please, let's make sure that we follow that. That means each other. So with that, I know we're late getting started. We're going to take an abbreviated lunch today, only 30 minutes, and abbreviated breaks. So no morning break. We're going to start now and go till 1. All right, Mr. Brennan, and we're taking a witness out of order. I apologize. We've got a witness here. Sometimes we take witnesses out of order. Ms. Hanley will be back later for the rest of her testimony, but we've got a witness here that we'll call out of order. Thank you. Mr. Brennan, thanks.
Thank you, Your Honor. The Commonwealth calls Dr. Wolf.
Stand up, step up, face the clerk, raise your right hand, please.
You solemnly swear the evidence you give to the court and jury in the case now and hearing to be the truth, the whole truth, and nothing but the truth, so help you God.
I do.
Thank you.
Good morning, doctor.
Good morning.
All right, whenever you're ready, Mr. Brennan.
Thank you, Your Honor. Good morning, sir.
Good morning.
Could you please introduce yourself to the jury, spell your first name and last name for the court reporter?
Sure. My first name is Isaac, Aizik. It's phonetic. Last name is Wolf, WOLF, like the real thing.
What do you do for a living?
I'm a brain surgeon.
Is there a special part of medicine that you study?
Well, my main interest in brain surgery is brain tumors and trigeminal neuralgia. But I also specialize in movement disorders. I do pediatrics and adults.
Are you an active working neurosurgeon?
I am very active working neurosurgeon. I get up every day at 4:30 in the morning to go to work, 5 days a week. I take call 300 days out of 365 days a year.
Did you work yesterday?
Yes, I did.
What type of work did you do yesterday?
I did 2 brain surgeries yesterday.
Are you working tomorrow?
I have 4 surgeries scheduled for tomorrow, which is why this is a little bit delayed for me, and I have 4 on Friday.
And what type of surgeries do you have tomorrow and Friday?
I have 3 brain tumors, 1 trigeminal neuralgia, and on Friday I have 4 patients with movement disorders.
You're here today as a witness. How much of your practice, how much percent of your income is from being a consultant or a witness for a case?
Probably less than 1%. I don't do this for a living.
I want you to take us through some of your education and background. Could you share with us where you went to medical school and where you graduated from?
I went to Yale Medical School. I graduated summa cum laude.
Was that in 1981 that you graduated?
Correct.
After medical school, did you begin internships in medical residency?
I did an internship at Hennepin County Medical Center, which is a trauma center in Minneapolis. I then did 5 years of neurosurgical residency at the University of Minnesota.
And was that in Minnesota?
Correct, in Minneapolis.
Is there something about that hospital that has some specialty?
It was one of the #1 training centers for chairmen in neurosurgery at the time.
Did you, in your residency and in your fellowships, do any work or study in pathology?
During your residency as a neurosurgical resident, you do 6 months in neurology, you do 3 months of neuroradiology, you do 3 months in pathology, which includes autopsies on brains. And then you do rotations through a trauma center as a chief resident, through a VA hospital, and then ultimately at the university hospital for elective cases. We also do 6 months of pediatric neurosurgical residency.
Did you do a fellowship at New York University?
Yeah, at NYU, I did a fellowship before I went to the University of Maryland as a professor in brain transplantation. The interest was in using cells to create dopamine centers in rat brains with the concept of Parkinson's being curable with transplantation.
I'd like you to take us through some of your faculty positions, and so you can share with us some of the progression of your training and experience. And did you begin at the University of Maryland Hospital?
Yes. In 1987, the University of Maryland recruited me to start their epilepsy surgical program and skull-based program. And then part of our responsibilities as assistant professors was to cover shock trauma.
Could you explain for us what shock trauma means and whether the University of Maryland Hospital was a shock trauma hospital?
So the University of Maryland and shock trauma were actually two separate entities when I started. A man named Cowley had basically developed the concept of the golden hour. So prior to Dr. Cowley, most trauma was just taken locally. That meant as a community hospital, if a patient had been in a motor vehicle accident, they needed an orthopedic surgeon, they had to call the orthopedic surgeon in, could take 15 minutes, could take 3 hours. The same thing for a vascular surgeon, the same thing for a neurosurgeon. Dr. Cowley came up with the concept that you needed a center that was strictly for trauma, and every attending had to be in the hospital 24/7. So that was the concept of shock trauma back in the 80s. When I got there, we were transitioning from a very small center to a 125-bed hospital that was completely committed to trauma.
In that experience, in the years you worked there, did you have an opportunity to treat a number of people with brain injuries?
We treated well over 100 patients a year, a month, basically, with brain injuries at shock trauma, along with spinal cord injuries.
Did you perform surgeries in different types of brain trauma and brain injuries?
Yes.
After Maryland in 1993, did you move to Miami Neuroscience Center?
Yes. In 1993, I left academics. I went into private practice in Miami, and I started the Miami Neuroscience Center. We were the first private community hospital to have what's called the Gamma Knife. So we were the 13th in the country, but the only one that was non-university based. And Gamma Knife radiosurgery is using radiation to operate on the brain.
Are you presently the director of the Miami Neuroscience Center at Larkin Hospital?
Yes, I am.
Do you conduct a number of surgeries a year there?
Correct. So I spent 19 years at Doctors Hospital, then we moved to Larkin Hospital 13 years ago, developing the new radiosurgical unit called ZAP, and also another fancy machine called high-frequency ultrasound to treat the movement disorders.
You've noted that you have a number of professional memberships. I don't want to go through all of them. I'd like to point out a few. Are you a professional member of the American Association of Neurological Surgeons?
Yes.
Are you a member, a fellow American of the College of Surgeons?
Yes.
Are you a member of North American Skull-Based Society?
Yes,
And is that brain-related?
it is.
Are you a member of the Society for Neuro-Oncology?
Yes.
Are you a member of over, or at least 34 different professional memberships?
Yes.
In your career, have you engaged in research?
Yes.
Has that research focused or centered on brain injury?
Yes, it has.
Is some of your research as a principal investigator for THAM treatment of brain tissue, acidosis in severely head injured patients?
Yes.
Did that research and as a principal investigator help you in your diagnosis and treatment of brain injuries?
It actually was in the treatment of severe head injuries, patients who are unconscious, the concept of trying to relieve the increased intracranial pressure that occurs from the injury and to increase blood flow, thereby increasing oxygen to the brain.
Did you also serve as principal investigator for research for the PEG, SOD, and severe head injury?
Yes.
Could you describe that very briefly?
Basically the same, one of the biggest problems in brain injury is the fact that blood flow ceases to exist as the brain swells up. And so one of the things we try to do is preserve the neurons by making sure that they have enough oxygen and blood flow to them. All these are agents that try to assist that.
I won't go through all of your research and principal investigator roles, but I want to ask you about one more. And that is, did you serve as principal investigator relative to the IRB protocol for brain pathology?
Yes.
And what did that do? What was that about?
It was about looking at what happens after brain injury to blood vessels and tissue as the intracranial pressure increases in the brain.
Have you been part of publications of a number of different books?
Yes.
I won't list parts of all 16 books, but can I point out a few?
Sure.
Were you the author of a book chapter regarding head injury, difficult medical management?
Yes.
Were you the author of a book chapter on pediatric neurosurgical emergencies?
Yes.
Were you the author of a book chapter on complications of head injuries in adults?
Yes.
Were you an author of a book chapter, imaging of craniocerebral trauma?
Yes.
Were you an author of a book chapter in emergency room assessment of the head injury patient?
Yes.
Were you the author of a book chapter, intracranial injuries?
Yes.
I won't list or ask you about the other book chapters that you've been the author of. Have you been involved in journal articles?
Yes.
I'd like to ask you just about a few of the 70 journal articles that you have published.
Your Honor, objection.
So go ahead and ask the question without a comment.
Were you an author of a journal article, Intracranial Pressure in Non-Traumatic Ischemia and Hypoxic Cerebral Insults?
Yes.
Were you the author of a journal article, Post-Traumatic Cerebral Infarction?
Yes.
Were you the author of the journal Fractures of the Clivus?
Yes.
Could you tell me a little bit about that paper?
We used thin cut CT scans to identify fractures of the skull base. Prior to this, prior to CT scans, it was very difficult to actually identify radiologically a skull fracture with plain x-rays. The idea was to see if we could identify more clearly. And so we classified them and delineated them in the paper and discussed the outcomes that were relative to those type of injuries.
In the last journal article I'll ask you about, were you the author of a journal article regarding acute traumatic midbrain hemorrhage?
Yes.
Were you the presenter in a number of presentations regarding head injury and brain injury?
Yes.
You've listed 93. I'll ask you just about a few. Were you a presenter in fractures of the clivus, clinical and radiographic features?
Yes.
Am I pronouncing that correctly?
Clivus.
Thank you. Were you the presenter in acute head injury?
Yes.
And a separate presentation, fractures of the clivus, classifications and clinical features?
Yes.
Do you lecture?
Yes.
Do you have peer-reviewed publications?
Yes. That was one of them.
Thank you. And are you heavily involved in clinical research?
Right now, my research is more based on radiosurgical techniques and outcomes.
Over your career and your study and your clinical experience, have you treated different types of brain injuries.
Yes.
Are you familiar with a number of different types of brain injuries?
Yes, we still treat them.
Were you asked to review materials relative to this case?
Yes.
And do you recall the materials that you reviewed?
Yes.
Could you share with us some of the materials that you reviewed?
I reviewed the chief medical examiner's assessment of the case. I reviewed pictures that I'm assuming the medical examiner took of the autopsy. And I reviewed the report from the forensic pathologist.
And before I ask you about your review of specific materials and your opinions in this case, is there a benefit to your clinical experience in studying brain injuries as opposed to the experience you had as a fellow simply with pathology?
Well, I think that for the jury to understand is a clinician understands the process from the time the injury occurs till the patient either leaves the hospital or dies. And it's a process. And as a neurosurgeon, I have a tremendous amount of experience with that, if that's what you're asking me.
Yes. And so, doctor, you reviewed a number of items of information in this case. Did you have an opportunity to review photographs of a laceration to Mr. John O'Keefe's head?
Yes, I did.
With the court's permission, I'm going to ask to display Exhibit 160.
Okay.
Dr. Wolf, I'm going to ask you to take a look at this photograph. Have you seen this photograph before?
Yes.
I want you to explain to us what you're seeing here and take us through the process of your observations.
Well, what we're seeing is an approximate 1.5 inch laceration with bridging tissue and contusions and abrasions. To us, that's just a classic blunt trauma injury. There's nothing other than just vanilla about it. This is what happens when soft tissue hits a solid ground. The skin tears apart a bit, but not through and through. As you can see, there's the bridging. You can see all the bruising or contusions and just the tear, a little bit serrated along the edges.
Thank you. If you could take that down. Dr. Wolf, as a result of that wound, did you have a chance to further look at information provided to you about the actual inside the skull of Mr. John O'Keefe?
Yes, it was the pictures that I was reviewing showed a non-depressed skull fracture extending linearly through the clivus and into the frontal fossa of Mr. O'Keefe over the orbital roofs. He had fractures along the temporal fossa as well. So it was a classic linear basilar skull fracture.
Is basal skull fracture a
It's
characterization?
basically the base of your skull is what it encompasses. So the opening at the very bottom is what we call the foramen magnum that connects your brainstem to your spinal cord. And then as your brainstem goes up, it goes into the different skull areas that, talk about what we call the cerebral cortexes, your occipital lobe, your temporal lobes over here, and then your frontal lobes.
So can you walk us through what happens when someone incurs this type of injury to the back of the head, how it happens, and what are the next steps for a person?
So what happens is, you fall backwards and the linear acceleration starts to take you back down with gravity. The skull hits the ground. It gets, in layman's terms, smashed a little bit. And then the brain moves forward as a response to that. And it moves forward because you have cerebrospinal fluid and because you have the deceleration, acceleration again. As it does, your skull, if you were to look inside your skull, it's like mini mountains along your temporal bones and your frontal bones. So the brain is being thrust forward at a fairly good speed, and it's getting bruised. You can think of it as if you took a hammer to your thumb. It's really turning black and blue. Those are the contusions. And so the temporal poles and the frontal poles are getting contusions because of that. At the same time, you have a space called the subarachnoid space. And I'm sure they're going to hear about the subarachnoid hemorrhage. And that space is it's very clear, thin membrane that covers all of your brain and all of your spinal cord. And normally, you really don't see it unless you open up the brain and you're operating. But when you either have a traumatic event like this, where little vessels are pulling apart underneath that membrane, or, for example, the classic, when you have an aneurysm burst, the space that the aneurysm bleeds to is the subarachnoid space. The other thing that occurs in trauma like this is you can get a subdural. So the dura is the membrane that covers the whole brain and also right down your spinal canal. And it's a very thin membrane that looks like very thin leather. And in that space between the brain and the dura can be a lot of veins that go towards a central vein called the sagittal sinus. And if those tear, you have a venous hemorrhage which is not arterial, so it's not quick, but that can develop into a subdural as well. If you tear a portion of your brain as well, and you get a little arterial bleeds, that could create a much faster subdural hematoma. And so when you look at the pathology, the autopsy of his brain, you're looking at a subarachnoid hemorrhage, you're looking at a subdural hemorrhage, neither one of them which was huge or would have required surgery, as well as the contusions that I described in his frontal poles, in his temporal poles, and then the original bang, which was in the occipital area. These are all findings that you would see on a CT scan and an MRI scan without requiring an autopsy if he had made it to the emergency room.
I want to take a step back at the beginning. You said that this laceration on the back of his head was caused by a fall. Could this be caused by a fall landing on hard ground?
Yes. I mean, like I said, it's a classic blunt trauma laceration.
Do you have an opinion to a reasonable degree of medical certainty whether this injury, the laceration and the basal fracture, was caused by Mr. O'Keefe falling backwards on the ground?
My opinion is that that's what caused his whole injury.
The pattern of the laceration, do you have an opinion whether that is consistent with hitting the cold, hard ground?
Objection, Your Honor. Can we have sidebar on that, please?
So I'm sustaining the objection, so no sidebar.
Your Honor.
Do you have an opinion, doctor, about whether that laceration on the back of his head was caused by a particular movement?
Well, the only way he could get this kind of an injury was to fall backwards, hit the back of his head, and then the resulting, energy forces going into his brain, into his base of his skull.
Would that type of laceration require Mr. O'Keefe to have hit a line type or a ridge type object?
A ridge type of object?
Yes.
No, I mean, like I said, the tearing of the skin in that fashion, you could look it up, would be just a classic blunt trauma injury.
Is there anything about that injury that would suggest to you it had to have been something sharp or ridge-like to cause?
Objection, Your Honor. Again, request kindly a sidebar on this.
All right, we'll come to
Thank you.
So as we were discussing, Dr. Wolf, you said this is a classic fall backwards. Is there anything about the pattern of that laceration that would suggest that there was a ridge or a line type edge that caused that wound?
Not necessarily.
And have you seen in your experience similar types of lacerations and breaks caused by falling on hard ground?
Yes, you can see that both in the occipital region. You can see it if patients fall on the, forehead. The skin tears, they're still bridging, and then they get bruises.
Some of your work was in Minnesota.
Correct.
Was it a colder part of Minnesota?
Very cold part of Minnesota.
you-
It's Minneapolis.
I'm sorry. Did you often see these type of injuries there?
Yes, I mean, we took care of a trauma center, Hennepin County. Very frequently, patients that are drunk fall down on ice sidewalks and could develop, lacerations in their head, epidurals, which are blood clots above the dura because they fracture a bone in the temporal area and they can get a bleed from a fractured artery. And it happens when people are shoveling snow and have a heart attack and fall backwards. So there are various ways that people fall, resulting in head injuries and lacerations to their forehead or to different areas of their head.
Can somebody suffer this type of injury simply by falling backwards?
Absolutely.
You had taken us through the process of falling backwards and then talked about what happens to the brain. Can I ask you a couple detailed questions about that?
Sure.
When you explained that the brain upon impact then shifts forward and hits the front of the skull, is there a medical term for that process?
Well, the medical term is a coup contre coup injury. So the coup is when you first hit. In this case, it was the back of the head, as summarized by the laceration in the back of the head, and the contusions that the pathologist and the ME found in the back of the brain. And then the brain shifts forward, and as it's traveling at a certain velocity, because it's thrust forward on the floor of the base of the skull, it's getting bumped. And it's getting, again, you can think of it as a hammer hitting a thumb. It's getting black and blue in the areas that are sharpest.
Are there symptoms that result of the process coup contre coup?
This is clinically, it varies. I mean, you can go from anywhere from a simple concussion where you sort of are unaware of what happened, but you're still awake, you're confused, all the way to, ultimately being in a coma.
Can this type of injury, the coup contre coup, and what you see in the review of your files, could this type of injury happen from an attack by a weapon, like a bat or a hammer?
Well, he did not have a depressed skull fracture. So any focal hit like that would more likely than not have caused a depressed skull fracture. Blunt trauma, the way he had, the assumption, would cause the coup contre coup without a depressed skull fracture.
When the coup contre coup process happens with the skull fracture, does anything happen to the front of the skull?
Well, you're asking me, does the rest, I mean, the forces, depending on how hard they are, can generate fracture lines all the way to the anterior fossa. So you can have fractures along the lateral temporal area. You can have fractures along the orbital roof. The orbital roof is very thin. And so those forces can go all the way to that area.
Did you see any sign of orbital fractures in Mr. O'Keefe?
Yes, he had both the ME and the pictures taken, and the neuropathologist mentioned fractures of the orbital roof.
Do you have an opinion to a reasonable degree of medical certainty how those fractures occurred?
From the trauma.
Could you just explain a little bit how that would happen?
Well, as he fell backwards and he struck his head, it was clearly at a very high speed generated by the gravity. The bone, depending on the quality of his bone, the density, then generated forces. There's a certain amount of lateral give, and then you get a linear force going forward. It drives all the way up the clivus and forward into the anterior fossa where his orbital roofs lay. And this is why people like this get what they call raccoon's eyes.
Do you have an opinion whether the brain itself could have caused the orbital fractures?
No, the brain is a soft substance. You could literally put your finger through the brain. We often operate on people fully awake. The brain couldn't possibly cause a fracture. The fracture was caused by the forces generated through that clivus, that middle bone in the middle of his base of the skull.
Do you have an opinion to a reasonable degree of medical certainty whether or not the brain in any way could have caused these orbital fractures?
The answer is absolutely not.
In your study of the records and photographs and in your experience treating these types of injuries, do you have an opinion to a reasonable degree of medical certainty whether or not a person would remain conscious or would be immediately unconscious after the impact of the ground?
Well, it's impossible to know whether he became immediately unconscious, but his injuries were very substantial, and it's more probable than not that at some point he quickly became unconscious and was unable to do functional activities.
What does functional activities mean?
The ability to, get himself up and about would be one of the functional activities. The ability to call for help would be a very significant cortical function. And that's why I was talking about, that there's a variation on the theme from a simple concussion to a severe concussion like this.
If a person does not have functional abilities because they are rendered unconscious, does their body, could it still move?
Yes, this is the interesting thing about our brain. So the cortex, which is the top portion of your brain, can get separated from your brainstem functionally. And what happens then is that your body is not acting autonomically, meaning vegetative. So why does that happen? We think it's because as we were a caveman, and if a caveman became unconscious, as an animal came up to eat it, the animal would touch it. Well, you have these automatic movements. One of them is called decorticating, which is where you draw your arms like this and you throw your feet out. And then a worse neurological situation is when you decerebrate. Now you push your arms out along with your legs. And that would scare off an animal. So we think that over time, genetically, this is what happened to our brains in order to create these. But those kind of movements are not thought processing, go ahead and decorticate or decerebrate. It's an automatic movement in response to pain.
I want you to take us back now to after the fall. Would Mr. O'Keefe, in your study and opinion, have died immediately?
No.
Can you share?
I don't.
I'm sorry.
Yes. I'll tell you. There is very few things that you head injury where you would die, quote, immediately. So if I took a knife and stabbed you in the back of your neck right below your skull and I drove it through your brainstem, you would probably die immediately. If I shot you below your ear and went through and through below your ear and shot through your brainstem, you would die immediately. But traumatic head injuries, you would not die immediately. It's a process. And it's a process of a combination of things. Brain swelling, which takes a while to develop. Decreased blood flow to your brain because you're getting swelling. And ultimately, death of the brainstem that controls your heart and your breathing. And so this is why there is a whole big issue about brain death. You know, when is someone brain dead? Because it's not instant and it can take a long time to be conceived. In these injuries that are very severe that we took care of, there was a high mortality rate. In the linear skull fractures, it was about 67%. But it took time for them to die. It could take days to weeks to months. And also, these people got to shock trauma. So it was a while, whether it was hours, before they were even starting to be taken care of. And yet they weren't dead yet. That's why I don't think it was immediate.
Was there any other observations you made about Mr. O'Keefe or his body that support your opinion that he didn't die immediately?
Well, the medical examiner took pictures of his periorbital area and diagnosed raccoon's eyes. So raccoon's eyes occur because there's leakage through the orbital fractures into the periorbital space. Normally, it takes about 24 to 48 hours to develop. It has been noted as early as 1 to 3 hours, which would make it not immediate.
Could we please have Exhibit 14? Dr. Wolf, could you share with us what you see here in this picture?
So right here, you can see the black and blue that sort of configures, if he had his eyes open, like what we describe as raccoon's eyes, right? And that's not caused by direct trauma to his eyelids. It's caused by what I described as the basilar skull fracture, which went to the anterior fossa, which is right over the orbit here, inside with leakage of blood products into that periorbital area.
You mentioned that starts or takes at least 1 to 3 hours to begin.
Minimally, yes.
You take that down, please. If Mr. O'Keefe had been brought to a trauma center or emergency room, what would the process be in your experience?
Well, he would have been intubated if he wasn't intubated in the field. One of the first things you need to do in a head injury is control the airway. Why? 2 reasons. One, you want to have enough oxygen going to the brain to feed it. And 2, you want to keep your carbon dioxide down because that causes increased intracranial pressure if it elevates. So you want to constrict the blood vessels a little bit. Then he would have had a CT scan immediately in order to assess whether he has a surgical head injury, meaning he needs to go to the operating room to evacuate something or not. During that process, he's obviously going to be getting medication to decrease the brain swelling. And from there, you make decisions based on his neurological function and what you're, capable of doing to, spare the brain from the rest of the injuries that will result. One of the things that occurs with contusions is a great medical term is they can blossom, which means they can get bigger. And if they get bigger, they might require surgical intervention to decrease the pressure as well as the volume of the blood that's destroying brain. And so you do serial CT scans in these patients over time, anywhere from every 6 to 12 hours to on a daily basis, depending on what the case by case, production of blossoming is occurring.
You mentioned that about 2/3 of your patients who suffer this injury pass.
Correct. What we saw is that in the patients that suffered linear clavicle fractures, 2/3 of them ultimately went on to die, and 1/3 lived.
Is there commonality on how they pass?
One of the common reasons they passed is if they trapped a major vessel in one of the fractures, they would get a significant brainstem infarct, meaning a stroke, meaning lack of blood flow to a very significant portion of their brainstem. And so that was one of the causes of death that ultimately we understood. And then the others died from the increased intracranial pressure that drove the brainstem down through the foramen magnum.
Did you review any materials that talked about or identified Mr. O'Keefe's body temperature when he was treated?
As I recall, his core temperature was 80 when he was found.
Is that significant in the process and development of his injury from the moment he fell and hit his head until his ultimate passing?
Well, hypothermia, if you define hypothermia, it starts at 95 degrees. Your core temperature is usually about 98, 98.6. 95 is very mild hypothermia. When you get to 82 degrees, you're in severe hypothermia. What happens when you're hypothermic, and I'm a neurosurgeon, but I can tell you that you get into multiple organ failure. Your heart starts to have problems. It can have arrhythmias. You're not breathing. And ultimately, at hypothermia, you also become unconscious and go into a coma-like state. Below 80 degrees, you're probably going to die. So all I can tell you, it wasn't helpful that he had a significant head injury and that he was then found hypothermic.
Is it uncommon in your experience for people that suffer this injury to pass within 5 hours?
Well, none of the patients we treated died within 5 hours, but it also didn't mean that we didn't realize that they were going to be in a potentially vegetative state. When someone's hypothermic, you have to warm them up in order to establish a clinical status, meaning you can't declare someone dead with a temperature of 80. You have to warm them up slowly, appropriately, and then reevaluate where they are clinically.
I've asked you questions about whether you had an opinion about Mr. O'Keefe and when he died. I want to ask it in the form of a formal opinion. Do you have an opinion to a reasonable degree of medical certainty whether Mr. O'Keefe died immediately or within 15 minutes?
No, I don't think he died immediately. Neither the hypothermia nor this kind of head injury would kill you immediately in any clinical experience I have.
Dr. Wolf, thank you.
All right.
Let me have a moment, Your Honor.
Sure.
Thank you.
May I, Your Honor?
Yes.
Morning, Doctor. I don't think we've had the pleasure of meeting. Welcome.
Thank you.
Sir, can you just describe, you started to do it a little bit on direct, a typical day for you?
I wake up at 4:15 in the morning. I go to my center. I set up patients with frames for their either radiosurgical procedures or stereotactic craniotomies. I go home. I make cappuccino for my wife at 6 o'clock in the morning. And then I get back to work at 6:30 and move on. I have patients that I'm operating on, and I have patients that I'm seeing through the day.
What type of patients and what type of work? Just in a typical day. What are you doing? What type of patients and what do you do?
It varies. I mean, I see patients with brain tumors. I see patients with hydrocephalus, which is water in their brain. I see pediatric brain tumors. I see subacute and chronic subdural hematomas, post-traumatic. I see patients with strokes that are being misdiagnosed. I see patients with cancer, metastatic disease. I used to see patients with cervical problems. I stopped doing that 2 years ago. I mean, I don't know what else you want me to tell you.
No, that's great. And is that typical day, typical of the type of days you've had for the past month, past few years? Is it generally, without specifics, is it generally?
Correct.
So none of your typical days, none of the past typical months have involved forensic pathology, have they? You haven't acted as a forensic pathologist in.
I am, if you could have asked that question, very straightforward. I am not a forensic pathologist. I'm a brain surgeon.
Right. And you don't perform autopsies, correct, sir? You're a brain surgeon.
Correct. In other words, I see more brains than the forensic pathologist.
Right. And is it correct to say that the brains that you see are of living people?
Correct.
Okay. So what I'd like to do is to go to a different part of the head than was discussed, but sticking with the decedent.
Excuse me, I didn't hear the last
I'm
word.
sorry, with the topic is going to be Mr. O'Keefe, the decedent in this matter, sir. You testified about raccoon eyes. The medical term for that, sir, is ecchymosis, right?
Correct.
And ecchymosis, raccoon eyes, does not cause a laceration to form on an eyelid, does it?
No.
Are you aware that Mr. O'Keefe had a laceration to the outside area of his right upper eyelid?
I am aware that the ME described that. Yes, sir.
Now, could, Your Honor, I'm going to, with Your Honor's permission, ask to publish what is already in evidence in a moment.
Okay.
Mr. Wolk,
What exhibit number, Mr. Alessi?
we're going to, 165, Your Honor.
Okay, go right ahead.
Thank you. Dr. Wolf, have you seen this photo depiction before today?
I believe I have.
Is it correct that that injury on the upper right eyelid is caused by the application of force directly to that area of the front of the head, again, namely the upper eyelid?
That's possible, yes.
Is it more than possible? Is it probable that that injury was caused by the application of force directly to that area of the front of his head?
Well, an easy answer to that would be is that that's not part of the periorbital ecchymosis.
Thank you, sir. That was exactly going to be my next question. This injury is unrelated to any of what you've been describing, the fall backwards, the force transfer inside the skull, the, as you described it, the dura, the cerebral spinal fluid, all of that dynamic that you so ably described on your direct examination. This injury has nothing to do with that, correct?
Correct.
I have one more moment, Your Honor. Thank you. Thank you for answering my questions, Dr. Wolf. A pleasure again. No more questions at this time, Your Honor.
Any brief follow-up on that?
No, thank you.
All right, Dr. Wolf, you're all set, so you can get out of here.
Thank you very much.
All right. Mr. Brennan?
May we have a moment to inquire of our next witness?
Sure. And while next to counsel inside our jurors, feel free to stand up and stretch. So jurors, you may realize that that went quicker than we thought. So we are ahead of schedule. So why don't we take that morning break that we can take? So we'll take a 15 or 20-minute break.
All rise for the court, please. Jurors, close your Put it back in session, you may be seated.
All right, may we have Ms. Hanley, please?
And ma'am, I'll remind you, you're still under oath and to keep your voice up. Thank you.
Good afternoon. All right, Mr. Lally, whenever you're ready.
Thank you, Your Honor. And ma'am, if you could just please introduce yourself to the jury again, spelling your last name for the record.
Sure. I'm Christina Hanley. Hanley is spelled Hanley.
And Ms. Hanley, given the break, if I could just ask you a few questions just to reorient as far as the items that we were speaking about yesterday in your testimony. First, starting with the items of glass that you analyzed in this case. The first of those items was an item 3-2, is that correct?
That's correct.
And if you could, please describe for the jury, or please provide the jury with the description for that item that you received.
Sure. So item 3-2 was a clear glass cup with broken irregular edges. And there was some dirt debris material that was noted on the exterior and interior surfaces.
Your Honor, may I approach?
Yes. Did you show counsel? All right, thank you.
I gave Mr. Jackson my copy, yes, thank you. Showing you a photograph, Ms. Hanley, do you recognize that?
Yes, I do.
And what do you recognize that?
So this is a photograph that I took. It's item 3-2, but it's also, I would have to double check on my notes, but I believe it has item 7-12, one of the pieces that I'm holding that's showing a physical match between those two items.
Your Honor, call both the seat to introduce in a minute to the next exhibit.
No objection.
Okay.
Exhibit 195.
And Your Honor, may I publish?
Yes.
Ms. Gilman, if I could have photograph 9490. Ms. Hanley, what's up on the screen? Is that the photograph that I just presented to you?
Yes, it is.
And if you could, please describe for the jury what we're looking at here.
So that is a photograph that I took upon examination. It is the clear glass cup item 3-2. And I'm holding another piece, which again, I believe it's one of the pieces from item 7-12. I would need to confirm in my file, but I'm showing that one of the pieces physically fits with item 3-2.
Thank you, ma'am. Ms. Gilman, you can take that down. May I approach again, Your Honor?
Yes.
Showing you two other photographs. If you could look at those, look up when you're finished. And do you recognize those?
Yes, I do.
And what do you recognize those?
So these are photographs that I took of item 7-12.
Your Honor, call both seat to introduce in a minute the next exhibit A and B.
Is there any objection?
No objection.
Thank you.
Exhibits 196A and 196B.
And Ms. Hanley, if you could just remind the jury as far as the physical description that you received in regard to item 7-12.
Sure. So item 7-12 consisted of some clear plastic pieces as well as 9 pieces of glass with broken irregular edges.
And may I publish, Your Honor?
Yes.
And Ms. Gilman, if I could have first photograph 9476. And if you can enlarge that just a bit, Ms. Gilman. And Ms. Hanley, what are we looking at in this photograph?
So this is the photo that I took of item 7-12 as I received it. So there's the several pieces of clear glass with broken irregular edges.
And Ms. Gilman, if I could have 9477. And if you can enlarge that just a bit. And again, Ms. Hanley, what are we looking at in this photograph?
Those are the same pieces of glass as in the previous photo, just a little bit more up close of the clear glass that was recovered and is item 7-12.
Thank you. Ms. Gilman, you can take that down. Now, Ms. Hanley, as far as a comparative analysis between items in 3-2, the glass cup, and 7-12 regarding the glass pieces, what, if any, conclusions did you make in reference to your comparison between those two items?
Sure. So upon comparing those items, I did note that 6 of the 9 pieces of clear apparent glass had a physical match to item 3-2, the clear glass cup.
And if you could just remind the jury, as far as a physical match, what does that mean?
So a physical match is basically if an item breaks and those items have broken irregular edges, if those pieces come back together like a jigsaw fit, then it's a physical match and they were at one time together as one larger unit.
Now, as far as each of those items within 7-12 had a letter associated with them, correct?
Yes.
And do you recall which of the 6 were a physical match for item 3-2, the glass?
I would just need to refer to my notes for the exact letters.
Sure, you can take your report out.
The 6 pieces of glass from item 7-12 that physically fit to item 3-2 were A, B, C, D, F, and K.
May I approach, Your Honor?
Yes.
Well, let me ask you this first. I'm sorry. So, Ms. Hanley, during the course of this physical match analysis that you're conducting, are you memorializing that process with photographs as well?
Yes, I am.
May I approach, Your Honor?
Yes.
I'm presenting you with 4 photographs. If you could review those and look up when you finish. And do you recognize those, ma'am?
Yes, I do.
And what do you recognize those?
Those are photographs that I took upon my examination of items 7-2.
Colonel Combo is introduced and admitted as the next exhibits, A through D.
No objection.
Thank you.
Exhibits 197A through D.
And may I publish, Your Honor?
Yes.
Ms. Gilman, if I could have 9502, please. And Ms. Hanley, what's up on the screen? Can you please describe for the jury what we're looking at in this photograph?
So this is one of the photos that I took of one of the breaks that physically fit together between item 3-2 and item 7-12.
And Ms. Gilman, if I could have 9514. And again, Ms. Hanley, can you please describe for the jury what we're looking at in this photograph?
Sure. So this is a photo that I took when I was doing my comparison of item 3-2 and several pieces from item 7-12.
Now, as far as the individual pieces had sort of little white stickers or labels affixed to them, is that correct?
Yes.
Is that something that you did, or is that something that when the items were provided to you was already done?
So item 7-12, I received those pieces with the labels already on them.
And again, those items, especially 7-12, had been with mixed veneer in your unit prior to coming to your table or your station, correct?
Yes.
Ms. Gilman, if I could have 9518. Again, Ms. Hanley, what are we looking at here?
So this is another photograph that I took of the physical match. It's just another view of the items together of item 3-2 and several pieces from item 7-12.
And lastly, for this batch, Ms. Gilman, if I could have 9520. And again, Ms. Hanley, what are we looking at here?
So this is another picture that I took of the items just slightly rotated of item 3-2 with a physical fit to several items or several pieces from item 7-12.
Ms. Hanley, is there a laser pointer on the desk in front of you?
Yes.
If you could, preferably using this screen just so it's visible for the jury, could you delineate where you see in this photograph item 3-2 and where you see the items associated with item 7-12?
So this right here is item 3-2, and these pieces up here are several pieces from 7-12.
Thank you. Ms. Gilman, you can take that down. Now, the other two items that you analyzed or examined in this part of your physical match analysis were items 3-3 and 7-14, correct?
That's correct.
And turning your attention specifically to item 3-3, if you could just remind the jury as far as the physical description of that item that was provided to you.
Sure. So item 3-3 was 5 pieces of clear glass with broken irregular edges that were recovered from the bumper of the vehicle.
May I approach again, Your Honor?
Yes.
Single photograph, do you recognize that?
Yes, I do.
And what do you recognize that?
That is a photo that I took of item 3-3.
Your Honor, come off the seat to introduce in a minute the next exhibit.
No objection, Mr. Jackson?
No objection, Your Honor.
Exhibit 198.
And may I publish, Your Honor?
Yes.
Ms. Gilman, if I could have 9446, please. And Ms. Hanley, in addition to the 5 pieces of glass associated with item 3-3, what else is depicted in this photograph?
This is a photo of the 5 total pieces that are from item 3-3.
And in addition to that, is there a ruler depicted in this photograph as well?
Yes, there is.
And what is the purpose of that ruler in the photograph?
It's there just as a scale.
Thank you, Ms. Gilman. You can take that one down. And Ms. Hanley, the last of those items, 7-14, if you could just remind the jury as far as what was the physical description that was provided to you in reference to item 7-14.
Sure. So item 7-14 was a clear piece of glass with broken irregular edges that was recovered from the road.
May I approach again, Your Honor?
Yes.
Again, Ms. Hanley, just showing you a single photograph. Do you recognize that?
Yes, I do.
And what do you recognize?
This is a photo that I took of item 7-14.
Your Honor, I'll seek to introduce the next exhibit.
No objection.
All right.
Exhibit 199.
May I publish, Your Honor?
Yes.
Ms. Gilman, if I could have 9471, please.
So
And again-
the two screens don't match. Thank you.
Thank you, Your Honor. Ms. Hanley, again, if you could just describe for the jury what is depicted in the photograph up on the screen.
This is the photo that I took of item 7-14.
Thank you. Ms. Gilman, you can take that down. So, Ms. Hanley, in addition to the physical match analysis that you did between item 3-2, the cup, and 6 of the pieces that you found to be a physical match from item 7-12, did you also compare pieces from item 3-2, 7-12, and 7-14?
Yes, I did.
And what did you conclude in your physical match analysis of those items together?
So upon examining and comparing item 3-2, 7-12, and 7-14, I had concluded that 6 of the 9 pieces of glass from 7-12 physically fit with item 3-2, and the remaining 3 of the 9 from 7-12 did not have a physical fit to item 3-2. I also compared item 3-2 and 7-12 to 7-14, but there was no physical match to item 7-14.
Now, in addition to that, did you also do a physical match analysis between item 3-2, the drinking glass, 7-12, pieces found from the roadway, and certain pieces from 3-3 from the bumper of the vehicle?
Yes, I did.
And what did you conclude based on that physical match analysis between those items?
So upon examining and comparing those items, so there were 5 total pieces of glass from item 3-3. I used 2 of those pieces for physical match comparison to the items recovered from the road. Upon my examination, I did not, there was no physical match between those 2 pieces from item 3-3 to any of the pieces recovered from the road. So that included items 3-2, 7-12, and 7-14.
Now, as far as the 2 pieces that you had selected from item 3-3, do you recall which of those 2 lettered pieces you chose for your comparative analysis?
Yes.
And which were they?
They were pieces A and B.
And if I could ask why pieces A and B versus other pieces?
So A and B were used for physical match. The remaining 3 of the 5 were not used for physical match comparison due to their size and condition.
Now, those same two pieces from item 3-3, pieces A and B, did you then do a physical match analysis between that and 7-14?
I did.
And what did you conclude from that analysis?
I concluded that there was no physical match between the two pieces from item 3-3 to item 7-14.
Now, did you also do a physical match analysis between piece E from item 3-3 from the bumper?
I did not. No, not a physical match examination.
Did you do any comparative analysis between a piece of glass E from 3-3 from the bumper and item 7-14?
Yes, I did.
And what did you conclude from that analysis?
So I selected piece E for further examination. I did microscopic examination as well as instrumental analysis, and I did the same microscopic and instrumental analysis to 7-14, and I compared the data, and I came to the conclusion that the piece that I sampled from item 3-3, piece E, was found to be consistent in physical and instrumental properties to the sample that I took from item 7-14.
If you could, Ms. Hanley, could you please explain to the jury when you say instrumental analysis, what is that? What does that consist of?
So the instrumental analysis that I conducted was on the GRIM instrument, which measures the refractive index of the samples. So after I had ran my samples for both item 3-3 and 7-14, I compared the data to determine whether they were consistent or not consistent.
And so when you say that something is consistent in instrumental properties, what does that mean?
So in this instance, they had consistent refractive indices.
Now, in addition to that comparative analysis for the glass items, what other additional examinations did you perform in this case?
Sorry, could you say that again?
In addition to items 3-2, 3-3, 7-12, and 7-14, what other items did you look at in this case?
So I also examined item 3-1 and item 7-18.18.
And what was the description provided to you in reference to item 3-1?
3-1 was a taillight, and there were also some other plastic pieces as well.
And taillight from the same vehicle as the glass from the bumper, correct?
Yes.
May I approach, Your Honor?
Yes.
You have another single photograph. Do you recognize that?
Yes, I do.
And what do you recognize that?
This is the photo that I took of item 3-1.
Your Honor, the Commonwealth will seek to introduce the minutes.
No objection.
Thank you.
200.
May I publish, Your Honor?
Yes.
Ms. Gilman, if I could have photograph 9394. And Ms. Hanley, do you recognize what's up on the screen as Exhibit 200?
Yes, I do.
And what do you recognize it to be?
This is the photo that I took of item 3-1.
And what's contained in here, is that a fair and accurate portrayal of what the item 3-1, the taillight housing, looked like when you received it?
Yes.
Now, as far as, and we'll get to this more a bit in a moment, but as far as any sort of comparative analysis that you did with any other item, What part of this taillight housing were you comparing to that other item?
So there were clear and red plastic portions of the taillight that appeared to be broken. So I sampled portions of the clear plastic as well as the red plastic on the taillight.
And just for clarity purposes, if you could with the pointer, as far as which of these pieces up on the screen were you sampling the clear and or the red plastic from?
So the red plastic that I sampled was from this area. It's a little hard to tell from here. I think I'd have to refer to my photo in my notes, but I think there were a couple of different areas that had clear broken plastic. I think this might have been one of the areas that was broken that I sampled.
And just for my purposes, really what I'm asking, Ms. Hanley, is the clear plastic that you used from item 3-1 was from the housing unit itself, the large piece, correct?
Yes.
Okay. Ms. Gilman, you can take that down. Now, the other item that you were comparing this to was item 7-18.18. Is that correct?
Yes, that's correct.
And what was provided to you as the description of that item 7-18.18?
So 7-18.18 was debris that was collected from 2 pieces of clothing from the victim.
And specifically, that would be 7-17, an orange T-shirt. Is that correct?
I believe that is correct, yeah.
Okay, as well as 7-18, a gray long sleeve shirt. Is that correct?
Yes.
And when you say that item 7-18.18 contained debris, what did that debris consist of?
So the debris consisted of one clear piece of plastic, as well as several pieces of red plastic, among some other trace material.
Now, were there measurements taken of those items within the debris, specifically the clear plastic and the red plastic?
Yes.
And what were those measured to be?
I would just need to refer to my report for that.
Okay, go ahead.
Thank you. Okay, so the clear piece of plastic in 7-18.18, it measured approximately 1/8 of an inch by 1/16 of an inch. And then I measured the largest and the smallest of the red plastic pieces. And the largest piece of red plastic measured approximately 1/16 of an inch by less than 1/16 of an inch. And the smallest piece among those measured approximately less than 1/16 of an inch by less than 1/16 of an inch.
And so those particular pieces that you measured, about how small are we talking about?
So the largest for the red plastic, the largest piece measured, just for visual purposes, it's roughly like the size of a grain of rice. The rest of the pieces were smaller than that.
And who within the lab provided that debris in that taillight housing to your unit, to the trace unit?
So the debris from the clothing was transferred to my unit by Maureen Hartnett, and the taillight was submitted to the lab by Trooper Christopher Moore.
May I approach, Your Honor?
Yes.
Showing you a series of 5 photographs. You can review those and look up when you're finished. Generally speaking, Ms. Hamden, do you recognize what's depicted in those photographs?
Yes, I do.
And what do you recognize those?
Those are the photographs that I took of 7-18.18.
I'm going to come up to seek to introduce and admit as the next exhibit, A through E.
No objection.
Thank you. It's 201 A through E.
Your Honor, may I publish?
Yes.
Ms. Gilman, if I could have photograph 9352. And Ms. Hanley, what is depicted in this photograph on the screen?
So this is one of the photos that I took of 7-18.18. This is how I received the clear piece of plastic.
And is that a tin that it's encased in at the time that you receive it?
Yes.
Ms. Gilman, if I could have 9355. And what is this, Ms. Hanley?
So this is a photo of the clear piece of plastic that was within that tin.
And Ms. Gilman, if I could have 9364. And Ms. Gilman, if you could enlarge this just a bit. Maybe just a little more, please. Thank you. And Ms. Hanley, what are we looking at in this photograph?
This is the photo that I took of the debris that was collected from the clothing items.
Ms. Gilman, if I could have 9366. And again, Ms. Hanley, what are we looking at here?
This is a photo that I took under a microscope of the red plastic pieces that I noted within the debris.
And lastly, Ms. Gilman, if we could have photograph 9369. And Ms. Hanley, what are we looking at here?
This is a picture that I took of the red plastic pieces that I removed from the debris.
Thank you. Ms. Gilman, you can take that down. Now, Ms. Hanley, in reference to your comparative analysis from item 3-1, the taillight housing plastic, to the clear and red plastic pieces of debris from plastic debris from item 7-18.18, the clothing of Mr. O'Keefe, what types of instruments did you utilize in this comparative analysis?
Sure. So after completing my examination, I utilized a comparison microscope as well as a polarized microscope, a FTIR, which is Fourier transform infrared spectrometer. And I also used a microspectrophotometer, also known as a microspec.
And what is a microspec?
So a microspec is an analytical tool that we can use to examine samples that have color. So it provides information on the sample's dyes and pigments.
And how is that utilized in your comparative analysis?
So I ran samples from both items that I was comparing, and I compared the data from those two items as a part of my comparative analysis.
And when you run that sort of data, can you describe for the jury sort of what that data looks like? Like, what are you physically seeing when you're examining the data from a microspec?
So what we refer to it as a spectrum or just a graph. And when we do the comparison, we can overlay those spectra or graph to determine if they are consistent or not consistent.
And I know you spoke a little bit about it in your testimony yesterday, but if you could remind the jury as far as an FTIR, what is that and how is that used in your analysis?
So an FTIR is another analytical tool that we can use. A sample is exposed to infrared light and it reacts in a certain way with that light. And what's produced is a spectrum of peaks and valleys that are representative and unique to your sample. And so that instrument was used to run samples from both items, and then the data was compared from both items.
Now, from your comparison of starting with the clear plastic from the debris from Mr. O'Keefe's clothing, from your comparative analysis of that clear plastic to the clear plastic from item 3-1, the tail light, what did you conclude?
So the clear plastic from the debris was found to be consistent in color and instrumental properties to the clear plastic from the taillight. So accordingly, the clear plastic from the debris could have originated from the clear plastic from the taillight or from another source with the same characteristics.
And with reference to the red plastic from item 7-18.18 from Mr. O'Keefe's clothing, in your comparison of that red plastic with the red plastic from the passenger side taillight of the defendant's vehicle, item 3-1, what did you conclude from that analysis?
So the red plastic that I sampled from item from the debris from the clothing from 7-18.18 was found to be consistent in color, microscopic appearance, and instrumental properties with the portions that I sampled from the red plastic from the taillight. So accordingly, the red plastic from item 7-18.18 could have originated from the red plastic that I sampled from the taillight or from another source with the same characteristics.
I'm sorry, Your Honor, if I could just hold on 1 minute while the sirens pass. May I approach again, Your Honor?
Yes. Actually, is this a good time to take a break, Mr. Lally? Luncheon break?
Entirely up to the court. I probably have another 3-4 minutes left.
I'm going to see counsel for 2 minutes, folks. Like I told you earlier, we're ahead of schedule, so we will take a luncheon break, and we'll take an hour. So I know we'll take an hour. Okay, we'll see you back here. So, we're just going to follow. Sure.
All rise to the court, please. Jurors, close your notebooks, follow me. Hey, this court's back in session. Please be seated.
Whenever you're ready, Mr. Hanley.
Thank you, Your Honor. Now, Ms. Hanley, when we left off, you were discussing the comparative analysis you did between item 7-18.18, Mr. O'Keefe's clothing, and item 3-1, the taillight housing or the plastic within the taillight housing of the defendant's car, correct?
Correct.
And there were a number of different instruments that you used through the course of your examination and analysis, correct?
That's correct.
And what were those instruments that you used again in that portion of the analysis?
Sure. So I used a polarized light microscope, a comparison microscope, an FTIR, and a microspec.
And Your Honor, may I approach?
Yes.
Showing you 3 documents, if you could review those with Dr. Finish, please. And do you recognize those?
Yes, I do.
And starting with the first page of that 3 pages, what do you recognize that?
It is the FTIR comparison data for the clear plastic from item 3-1 and the clear plastic from item 7-18.18.
If I could direct your attention to the second page within that, what do you recognize that?
So this is also FTIR comparison data from for the red plastic from item 3-1 and item 7-18.18.
And lastly, the third page within that set, what do you recognize that?
So this is the comparison data from the microspec from the red plastic from the item 3-1 and the red plastic from 7-18.18.
Your Honor, the Commonwealth will seek to introduce and admit as the next 3 exhibits individually.
No objection, Your Honor.
All right, thank you.
You want them marked individually or you in a set?
Individually, please. Thank you.
Exhibits 202, 203, and 204.
Thank you.
And again, Ms. Hanley, when it came to your analysis of the clear plastic material from the debris from John O'Keefe's clothing and the clear plastic material from the defendant's taillight, what were your conclusions from that analysis?
Sure. Upon comparison, the clear plastic from item 7-18.18 was found to be consistent in color and instrumental properties with the clear plastic from item 3-1. Accordingly, the clear plastic from 7-18.18 could have originated from the clear plastic from item 3-1 or from another source with the same characteristics.
Thank you. Your Honor, may I publish, and I'm sorry, I forgot already the
Yes.
exhibit numbers, but
Yes.
Ms. Gilman, if I could have the clear plastic. And Ms. Hanley, can you describe for the jury what we're looking at in this, what's up on the screen right now?
Sure. So this is the FTIR comparison data of the clear plastic from item 3-1 and the clear plastic from item 7-18.18.
And Ms. Hanley, if you could, using the laser pointer before you, if you could direct the jury's attention to which is which as far as the top and bottom.
Sorry. The top,
Sorry, I apologize, Your Honor.
That's okay.
the top spectrum is item 3-1, and the bottom spectrum is item 7-18.18.
And Ms. Hanley, when you're comparing these two, as far as the data that you receive, what is it specifically that you're looking at in your comparison as far as the data is concerned?
So when I'm comparing the spectra, I'm looking at the peaks in each sample to determine if they are consistent or not consistent.
Thank you. And if I could turn your attention to the red plastic material from the debris from Mr. O'Keefe's clothing and the red plastic from the passenger side taillight of the defendant's vehicle, what did you conclude in your analysis there?
So upon comparison, the red plastic from 7-18.18 was found to be consistent in color, microscopic appearance, and instrumental properties with the red plastic from item 3-1. So accordingly, the red plastic from 7-18.18 could have originated from the red plastic from item 3-1 or from another source with the same characteristics.
Thank you. And Ms. Gilman, if I could have the red plastic data. And Ms. Hanley, directing your attention to the screen again with the laser pointer, if you could delineate for the jury as far as which set of data is associated with which item.
So the top spectrum is item 3-1, and the bottom spectrum is item 7-18.18.
And again, if you could just direct the jury's attention with that laser pointer to the areas as far as the data peaks and valleys that you're looking at in comparison of this data.
So when I'm comparing them, I'm comparing the peaks to each other in each of the spectra to determine if they are consistent or not consistent.
And in this case, you found them to be consistent. Is that correct?
That's correct.
And Ms. Gilman, lastly, if I could have the microspec data. And Ms. Hanley, if you could describe for the jury, please, what are we looking at in this particular data set?
So this is the comparison data from the microspec of the red plastic from item 3-1 and the red plastic from 7-18.18.
And as far as the data in any microspec, but particularly this one up on the screen, using that laser pointer, could you illustrate to the jury sort of what these individual lines or what this data means?
So these are the samples that I ran, and samples that I ran from item 3-1 and 7-18.18, and the spectra are overlaid in order to determine, to look at it and to determine whether they have a consistent or not consistent pattern.
And the pieces of plastic from Mr. O'Keefe's clothing and the pieces of plastic from the defendant's taillight, what do you observe as far as from overlaying those two sort of data points?
So I determined that they had consistent microspec data.
Again, if you could just remind the jury as far as the microspec data, what type of data is that?
So the microspec, it analyzes samples that have color. So it provides information of a sample's dyes or pigments.
Thank you very much. Ms. Gilman, you can take that down. Thank you, Ms. Hanley. I have no further questions, Your Honor.
Okay.
Good afternoon, Ms. Hanley.
Good afternoon.
Nice to see you again. We met about a year ago. First things first, you were just talking about some plastic pieces in 7-18.8, correct?
It was 7-18.18.
0.18, I left the one out. 7-18.18. We're dealing with a lot of numbers. I'm going to see if we can cut through that here in a second.
Sure.
First of all, you indicated that you were doing a comparative analysis in different, sort of different categorical ways, using microscopy, using the microspec, using the FTIR. I think you also use the FTIR in that as well.
Yes.
And you indicated that your analysis concluded with those pieces could have come from the same source, from the source in 3-1, the taillight. But you're not conclusively saying they did, correct?
It could have come from, they could have a common origin, or it could have come from another source with the same characteristics.
Right. So in other words, another way to say that, Ms. Hanley, is it may have come from the taillight, may not have.
It's a possibility.
Okay. I also want to ask you real quick about the taillight manufacturer. You were shown an exhibit. I think it's exhibit 200, and I think we have that available. With the court's permission, we don't have to cut the lights. I think the lighting is just fine. This is exhibit, or a photograph of exhibit 200 that you saw just a second ago. Quick question about that. In your inspection of that taillight, it's true, is it not, that that is manufactured entirely of plastic or plasticine pieces? There is no glass in that taillight, correct?
I have to check my notes. I don't think I noted any glass.
Okay. So in other words, you didn't note any glass inherent in the manufacture of that taillight. It's basically plastic.
Yeah, I think most of the parts were plastic. I'm not 100% sure if the entire thing was plastic. There may have been other material, but portions were plastic.
But you certainly didn't see any glass inherent in the manufacture process.
I'd have to double check my notes, but I don't think I did.
Okay.
Do you want her to check her notes?
Why don't you? Are your notes in front of you?
Yes.
With the court's permission.
Sure.
Okay, so I did not make any notation that I noted portions that were glass.
Great. Final point before we get into the actual analysis. On any of the glass, I want to shift gears to just the glass material that you analyzed and that you looked at and you inspected. You saw no blood, no skin, no biological material, no tissue, human tissue or otherwise, on any of those pieces that you inspected, did you?
Upon examination of those items, making observations of those types of material, that's not my area of expertise. I don't think I noted anything that was maybe consistent with that.
So in other words, even though you're not in the bio material expert section of the lab, you certainly would have noted if there was skin or biological material or obvious blood on glass pieces. You're looking at them in many cases through a stereo microscope, correct?
Yes, I would have made note of observations of anything that I would have noted on the surface.
Great, and you did not, because you didn't see anything that was suggestive of that,
I think I just made note, I have to check each item, but I think I did note that there was some dirt debris on some of the items.
But not biological material.
I did not note anything that would be maybe consistent with that.
Great, thank you. I want to talk about the comparisons that you did. And you'll forgive me, I'm a visual learner. So I'd like to talk about it in 4 categories.
Okay.
Linear categories. Category 1, item 3-2. Category 2, item 3-3. Category 3, item 7-12. Category 4, item 7-14. 3-2, 3-3, 7-12, 7-14. Can we talk about them in those particulars?
Sure.
Okay. 3-2 was the cup, correct?
That's correct.
Okay. And I'm going to use the word cup rather than glass for obvious reasons. You can get confused by that. So when I say the cup, do you know what I'm talking about?
Item 3-2.
Great. 3-3 are the 5 items that were found on the bumper, claimed to have been found on the bumper by MSP or crime. Okay?
Yes.
5 items, A, B, C, D, and E, correct?
Correct.
Item 7-12 are 9 items, glass items, that were recovered at 34 Fairview by Trooper Buchanan in an evidence envelope, correct?
So sustained as to who they were recovered from.
Sure. Did you receive the items along with an evidence envelope?
I need to double check if it was an envelope, but I received it packaged.
Okay. And the packaging normally, under normal circumstances, the packaging comes with labels that gives you reference about where things came from. For instance, when Mr. Lally asked you, were you aware or did you become aware that items were claimed to have been found on the bumper? You didn't actually find those items, but that was the description you were given, correct?
That was the description of the item in our limb system.
Okay. And going back to 7-12, that's our 3rd category. Was that described as 9 pieces of glass that were found at 34 Fairview by a sergeant by the name of Buchanan? Or do you recall that?
I am not sure who recovered them.
Or what it said on the evidence envelope? That's what I'm asking.
I would have to check my photos to see if it says that.
We'll get to that in just a second. But fair enough. 7-12, 9 items, A, B, C, D, E. And if my memory serves, I, K, and L.
I'd have to refer to my notes to.
Can you please?
Yes. So the 9 pieces of glass from 7-12 were labeled A, B, C, D, E, F, I, K, and L.
Great. And then finally, what was in 7-14, that's an easy one, 1 piece of glass.
That's correct.
Okay. Your Honor, may I approach?
Yes.
If I could, Ms. Hanley, I'm going to hand you photographs. That should be 2 photographs of the exact same thing. Do you recognize what's depicted in that photograph?
I've never seen. I did not take this photo.
Understood.
So I'm not. I haven't seen them, so I don't know.
So I'm asking you to look. I know you haven't seen that photo. Does it look like the cup?
It looks consistent with the cup.
Okay. take a look at the second photo. Do you recognize what's depicted in that photo?
So again, I did not take this photo. It appears to be a photo of a container that another analyst took a photo of item 7-12.
And item 7-12, once again, included plastic pieces and 9 glass pieces, correct?
Correct.
Do you see the evidence label on the very top of that evidence envelope?
I'm not sure which label you're talking
The
about.
one
Oh,
under the red tape.
yes.
Does that appear to be a label marker that's done to maintain chain of custody?
So I think that label. Sorry.
Sure, can we bring these over to the side?
Sure.
Jurors, sometimes we're at sidebar in an effort to try and speed things up. So even though we take your time that way, this should make things move a little easier. So you can cut that, come back.
Thank you. Ms. Hanley, I was asking you previously, we'd already looked at what's been marked for identification as triple G. I was asking you about what has now been marked as triple H. If you'll just look at that, what I'm most interested in is, do you see a name, a trooper's name in the middle of that evidence bag?
Yes, I do.
Is that Buchanan?
It looks like it says that, yeah.
Okay, and just so we're clear, that bag is associated with 7-12 of your analysis. The item 7-12, correct?
Yes, again, I didn't take this photo, but I have,
I
yeah.
realize that. It says 7-12
Yeah.
right on the photo. doesn't it?
Yes, yeah.
Okay, that's all I need. Taking a look at what's been marked as triple I for identification. Do you see a name associated with that evidence bag?
Yes.
What name is that?
It's actually a little hard to read. It looks like it says, it could say Trooper Proctor.
Okay, and that is associated with 7-14, our fourth category, correct?
It is labeled as, excuse me, 7-14.
Thank you. And finally, does that, which has been marked as, for identification at least, as triple J, does that appear to be the contents of that bag, which is a single piece of glass in 7-14?
This appears to be the photo that the analyst prior to me took of item 7-14.
And that would be analyst Valier.
Correct.
You see her initials there.
Yes.
Okay, thank you. So the four categories, just so we're clear and we can stop using so many numbers because they can get confusing. 3-2 is the cup, right?
Yes,
3-3 is the bumper glass, correct?
that is correct.
7-12 is the Buchanan glass, correct? You just looked at it,
Yes,
okay? 7-14 is the Proctor glass, the single piece, correct?
correct.
So when I make reference to those items by those names, you'll know what I'm talking about.
Yeah. Yes.
Hesitant.
No, I just, I'm just used to referring to them to the item numbers, but I will try to stay with you.
My brain will melt if we continue that way.
Can she do it both, Mr. Jackson?
Sure. Any way that you wish. I have another document that I would like to approach with, if I could, with the court permission.
Okay.
Thank you. I'd like you to take a look at that. You've got a copy of this. Have you ever seen that before, or a variation of it?
Yes,
Okay, saw it last year, correct? Or something close to it last year?
yeah, it looks consistent.
Okay,
I'm sorry, may we approach on this?
Okay. If there are any others, Mr. Jackson, why don't we bring all the
this is it.
So I think I gave somebody the copy that I was using. I need a copy.
If I may approach?
Yes. Thank you. All right, so let's mark this first for identification.
Happy to.
KKK for ID.
Ms. Hanley, if I could ask you very briefly, I want to go through this chalk with you for a moment. Do you recognize something on the left? Looking at the first category. Do you see 3-2?
Yes,
How is that described?
it's described as a cup.
Okay, and you see that there's a photographic representation of the cup just above it, correct?
It looks consistent with,
Okay. Moving to the second category. What category is that?
it's item 3-3.
And 3-3, first of all, there's a photograph above it. Do you see that?
Yes,
It appears to be a bumper, correct?
yes,
You didn't take that picture.
I did not.
Okay, let's look down beneath it. You indicated that there were 5 items in 3-3, A, B, C, D, and E, correct?
Correct.
Do you see A, B, C, D, and E represented in that category on this chart?
I do see A, B, C, D, E categorized, yes.
Great. Under A, you previously testified that the bumper glass sub A in 3-3 did not match the cup, correct?
That's correct.
Did not match anything in 7-12?
Sorry, just give me one moment. That's correct.
And did not match anything in 7-14?
That's correct.
And you see those represented by sort of the international symbol for negative, correct? A circle with a line through it. Correct?
Yes.
Okay. Under subcategory B, glass B, or item 3-3B, did not match the cup, did not match 7-12, did not match 7-14.
That's correct.
Is that accurately represented on the chart?
Yes.
Finally, with regard to E as an echo in that same item, 3-3, you see that there is a green indication that glass recovered by Proctor does match or did match in your analysis or was consistent with the item in 7-14, correct?
It was consistent microscopically and instrumentally.
Does that accurately reflect that finding on this chart?
Yes.
Okay, now turning to category 3. There were 9 pieces of glass that you looked at, correct?
Correct.
A through F, I, K, and L. Is that right?
If I could just reference my report to make sure.
Of course.
Yes, those are the correct letters.
And A, B, C, D, F, and K all matched the cup, correct?
Again, I would just need to confirm with my report.
Take your time.
Yes, so A, B
That's the cup.
had a physical match to 3-2, the cup.
Is that accurately represented on this chart? With green.
Yes.
And E is an echo, I is in India, and I think that's L is in Lima, did not match the cup, correct?
That's correct.
Okay, is that accurately represented on this chart?
Yes.
And finally, the last category, 7-14, that is the single piece of glass that was recovered by Trooper Proctor. That did not match the cup, and it did not match anything in 7-12, correct? need to check your notes, feel free.
Yes, that's correct.
Is that accurately represented on the chart?
Yes.
Your Honor, I would move for the admission with the amendment that the court indicated at sidebar of triple K.
Okay, I'm going to allow it in.
205.
205? Your Honor, the court indicated that it would like to see us before anything's published to the jurors.
Okay, come on over for a second. Actually, have those have those been done?
It has been done, and I was going to explain it sidebar.
All right, then come on over. $205.
Thank you. Request permission to publish.
Yes.
Ms. Hanley, you see the chalk that's been, or actually what's been marked as Exhibit 205 in evidence on the screen?
Yes.
Is that consistent with what you and I were just talking about at the witness stand?
Yes.
If you'll direct your attention to the screen on the right, just because it's a little easier and I think the laser pointer shows up a little better. You see the 4 categories represented in this exhibit?
Yes.
Okay, so 3-2, I'm going to go over it very quickly one more time, just visually. 3-2 on the left is the cup, correct?
Yes.
3-3 represents the 5 pieces of glass of what we call the bumper glass, A, B, C, D, and E, correct?
Yes.
7-12 is the 9 pieces of glass recovered by Trooper Buchanan at 34 Fairview, correct?
Yes.
And finally, 7-14 is the single piece of glass recovered by Trooper Proctor, correct?
Yes.
Taking these one by one, just so everybody see? Taking these one by one, looking at starting with the bumper glass, category 2. Piece A did not match the cup, anything in 7-12 or anything in 7-14, correct?
That's correct.
Piece B did not match the cup, did not match anything in 7-12, did not match.
That's correct.
And moving over to category 3, there were some matches in these 9 items, 6 of them, A, B, C, D, F, and K, correct?
Yes.
But what those matched, Ms. Hanley, with a cup, nothing on the bumper, correct?
Correct.
And what didn't match the cup were E, I, and L. Is that right?
That's correct.
Moving back to category 2, however, there was one thing, item E, that did match something in this series of categories. Isn't that right?
not a physical match, but instrumentally there was consistency.
All right. And this was an item, the only piece of bumper glass, the only piece of bumper glass to match anything else in your analysis. Matched what? Or was consistent with what?
So item 3-3, piece E, was consistent in physical and instrumental properties with the sample that I took from item 7-14.
Which is the single piece of glass recovered by Michael Proctor, correct?
Yes.
But not a single piece of glass, nothing that you analyzed coming from that bumper matched the cup, did it? Nothing.
Physical match comparison, there was no physical match comparison to the cup.
Are we done with this, Mr. Jackson?
We can take this down, Your Honor. Your Honor, that's all I have. Thank you.
Mr. Lally?
Now, Ms. Hanley, as far as you were asked some questions on cross-examination about biological pieces or tissue or things being on the glass, and you referenced that that was done in another unit, correct?
Yes, if that type of examination was needed, that would be done in a different unit.
Objection, Your Honor.
I'm going to allow that, but next question.
Which unit would that be conducted in?
Objection.
So the objection sustained. You need more, Mr. Lally, before you move on.
Now, as far as the chalk that you were just presented, as far as the 4 photographs that were depicted in there, have you ever seen any of those 4 photographs before?
No.
Do you know specifically who or where any of the items 3-2, 3-3, 7-12, or 7-4 were physically recovered from?
I just have the description that's put in the LIMS system when it's submitted to the lab.
And do you know that 3-2, the drinking glass, was recovered by the Canton Police Department on January 29th, 2022?
Objection.
Sustained.
Do you know that item 3-3, the bumper glass, was recovered by Ms. Maureen Hartnett from your lab on February 1st, 2022?
Sustained.
Do you know that each of the 4 items were recovered by different people on different dates at different locations?
Yes.
Ms. Hanley, from your conclusions that you testified about before, you found that the item 3-2, the drinking glass, was consistent with 6 different pieces from item 7-12 that were found in the roadway outside of 34 Fairview Road, correct?
That's correct.
And you also found that piece E from item 3-3, the bumper glass, was consistent with the single piece from item 7-14 that was found in the roadway outside of 34 Fairview Road. Is that correct?
Yes, that's correct.
And you also found that items from 7-18.18, the debris from Mr. O'Keefe's clothing, were consistent with the item 3-1, the taillight housing, correct?
Objection, Your Honor.
Sustained as to form.
Now, as far as the chalk that you were presented with on cross-examination, was there anything in there about item 7-18.18 or item 3-1, either the taillight housing or the debris from Mr. O'Keefe's clothing?
No, there was not.
Nothing further.
Anything?
Very briefly. So in sum, not a single piece of glass on that bumper could be connected to that cup, correct?
There was no physical match to the pieces that I compared for physical match from the bumper. There was no physical match to the glass cup 3-2.
Thank you. So another way of saying that is not a single piece of glass that you analyzed on that bumper matched that cup, correct?
Sustained.
But the one piece of glass that did match something came from the same source, or was consistent with coming from the same source as the single piece of glass recovered or in possession of or bagged by Trooper Michael Proctor, correct?
It was consistent with item 7-14.
That's all.
All right, Ms. Hanley, you are all set. I'm going to see counsel for a minute. Jurors, feel free to stand up and stretch. All right, so jurors, I know you don't like it when we're at sidebar. We don't like it when we're at sidebar, but I can tell you that after speaking to the lawyers now, we're ahead of schedule. And they've worked very hard to get us to this point where we're ahead of schedule so that tomorrow, instead of being a half a day, you have tomorrow off. So you have tomorrow and Friday, a good long weekend It's very, very important. Do not discuss this case with anyone. Don't say a word about this case. Don't let anybody say anything to you about this case. Don't do any independent research or investigation into this case. If you happen to see, hear, or read anything about this case, please disregard it and let us know. I believe next week, except for Thursday, are full days every day. Watch your social media use this weekend as well. Have a great long weekend. We'll see you here Tuesday morning, ready to go.
Court, all rise to the jury.
Goodbye.
You can't hide from hillbilly crime.
You can't hide from hillbilly crime.
You can't hide from hillbilly crime.
You may not know that there's a crew in town. The head hillbillies are making their rounds. Small town whispers loud and clear. The sheriff shot the judge in his chambers chair.
Sheriff got a secret he won't keep. Judge shot dead in his disbelief. A lot of people have some stories to tell. Dark passed away, get the sound of a shotgun shell.
All the secrets spill on down. Voices loud in this old town. From the courthouse to the ground. Rumors fly and they can't be bound.
Neighbors hide behind their blinds. Whisper tales of troubled minds. Skeletons covering the mountainside. A treacherous reality in the pines.
Winter reveals the hidden lies. Moonlight couldn't mask the cries. Shadows caught in sunlit skies. There's no cover, no disguise. All the